This video is going to be all about some key terms and ideas that are going to set the stage for our discussion on the microbial mechanisms that pathogens use. So first up is going to be contamination versus infection versus disease. And these are going to be the microbiology definitions, which are in contrast to how we sometimes use these terms in our day-to-day conversations. So for contamination, this is where microbes gain access to the host, okay? And so an example of this would be maybe you're talking to a friend of yours, and while you're mid-sentence, your mouth is open, right? You're breathing, that person coughs in your face. So microbes that may not normally be part of your respiratory tract, right, in your mouth and nasal cavities, are now introduced because they coughed on you while you were talking and breathing. So at that point, contamination has occurred. Now, sometimes, right, that's where it's going to stop. They're not really going to replicate or progress. You know, maybe you just so happen to have mouthwash and you go clean out your mouth, okay? But contamination is the first step to getting an infection. And an infection is when microbes begin to replicate on or within the host, okay? So if in this example, right, you continue on with your conversation, maybe you're a little grossed out, but those microbes that just contaminated you now start replicating in your nasal cavity or in your mouth or throat. At this point, you have an infection, but there are no signs or symptoms present. You don't feel any different, okay? You feel like your normal, healthy, happy self, okay? However, when you start to feel different, that is when we say you have a diseased state. Okay, so there is a change in how you normally feel. And normally in our day-to-day conversations, we probably use the term sick as opposed to disease, right? You might say, oh, I'm sick with strep throat. But in microbiology, that is a diseased state. So we would refer to strep throat as a disease because it is a deviation from how your body normally feels and functions, right? Maybe now you're coughing a lot, or you're, in this example, maybe you wake up and you have a stuffy nose or a scratchy throat. But this deviation is now referred to as a diseased state, okay? So a contamination may lead to an infection, but maybe it stops there. Okay, maybe the immune system is like, nope, not today, pathogen, and everything clears it, and you never know the difference, right? Maybe you just stand a little farther back from your friend next time. But it is possible that an infection can lead to disease, which again is when you feel different than you normally do, okay? So please know infection and disease are not and should not be used interchangeably. Okay. Next up are the types of flora. So remember, when a baby is born, okay, the body is axenic. And what that means is the body is essentially a sterile environment, okay, because the environment within the uterus is sterile. And so as the baby is born, maybe it comes out that birth canal, right? Suddenly it's exposed to the air and people breathing on it and touching it. So as this is happening, microbes are colonizing on that baby, right? And most of this is healthy, right? It's establishing its normal microbiota, which is good, okay? Now, as time goes on, right, in a normal child and adult, we have normal microbiota present in a lot of our body systems, our GI tract, our respiratory tract, our genitourinary tract, right, places like our eyes, our nose, right, so those are part of the systems I just mentioned, right, so we don't have organisms everywhere inside the body. As we get to the different diseases in unit 4, we will talk about some parts of our body that do remain axenic as well, even, when we're in our 30s, 40s, and beyond. But remember, there are organisms within most parts of our body that help us, okay? And we'll talk about how that is later. But these are our resident flora, okay? And so these are good, and which is why you want to be careful with antibiotics, like we talked about last unit, because not only do antibiotics target the bacterial pathogen, but it can also target your normal microbiota, which can wreak havoc. All right. So next up are transient flora. So these are microbes that just normally get on our body through just normal daily behaviors, but they don't reside there. Okay. So, you set your phone down on your desk, right? So it might acquire some pathogens, and you pick it up, you take it with you everywhere. As you touch your keyboard, your mouse, maybe you ride a public transportation, okay, you open doorknobs, all of these different things that you're touching or people that you're speaking to, right? They're introducing microbes to your body. And so normally as you wash your hands or maybe you shower, right, you are going to be removing those organisms. So they are only temporary. My screens are going crazy and I don't know why. So I apologize for that. Please hold while I figure out what is going on. Hold on a second, y'all. I'm really sorry. Okay, I think I've got it. So an example, or really a good example of transient microbes, or where these are more of a concern, is in a hospital setting. Because, right, nurses, healthcare providers, volunteers, doctors, they are constantly exposed to pathogens, right? And so that's why it's important that they change their gloves often, or sometimes they'll put hand sanitizer on as soon as they walk into a new patient's room. A lot of times they don't want people touching their phones a lot, right? Because as you set your phone down, maybe you set it down in the bathroom or on, a shared dining space, it's picking up possible pathogens, especially in the healthcare settings where you're surrounded by sick people. And so it can be more of a problem in these healthcare settings because it's easier to pass pathogens to patients that already have an immunocompromised system. Okay, but normally in just like your house or work, normally transient flora aren't too problematic. But of course, then we have our opportunistic pathogen. Again, these are those normally harmless organisms, but when the opportunity presents itself, they can cause an infection or even lead to a diseased state. And so some common ones that are in your notes, Staphylococcus aureus can lead to various skin diseases and respiratory diseases. It's a pretty hardy organism, and we'll talk more about that in Unit 4, but it can survive a lot of environments that most pathogens can't. E. coli, if it gets into the wrong part of the body, then it can lead to like urinary tract infections. And then C. albicans, that is yeast. So we talked about how if you do take antibiotics and it wipes out your normal vaginal microbiota, yeast can replicate and kind of grow out of control. So normally yeast is good, part of our normal vaginal microbiota, but when the opportunity arises, it grows more than it should and can lead to yeast infections, okay? So one thing I want to mention is there's a lot of examples of organisms and diseases in the PowerPoint. I am not going to quiz you all about Neisseria meningitis, but you do need to be able to apply these definitions to a scenario, okay? So make sure you understand what an opportunistic pathogen is. I left a lot of these details in the PowerPoint because Unit 4, you're going to get bombarded with tons of diseases and the organisms that cause it and how they make you sick. And so by incorporating it in the PowerPoints, as you read over them to study for test 3, these names and diseases and things are going to become a little bit more familiar. So it's going to hopefully make exam 4 a little easier. Okay, last kind of big terminology slide is going to be the terms pathogenicity versus virulence. A lot of people tend to use these interchangeably, but they should not, okay? So pathogenicity just means, can or does the organism cause disease? Is it a pathogen? And that's a yes or no question. If the organism can cause disease, it's a pathogen. If the organism cannot cause disease, it is not a pathogen. That's it, yes or no. But virulence, on the other hand, is the degree to which an organism is pathogenic, or the degree to which an organism can cause disease. So this is more a spectrum of pathogenicity. Some pathogens are more virulent than others, okay? And we'll talk more about these next two ideas in a later video, but these are two ways that we can kind of describe the virulence of an organism. The ID50 is the infectious, or the number of microbes required to cause an infection in 50% of the population, okay? LD50 is the lethal dose. So that measures how many microbes must get into the body to cause death in 50% of the cases, okay? And so you can use these numbers to kind of rank the pathogens, okay? So in the PowerPoint on slide 13, I told you to edit this slide. So it says pathogen A has an infectious dose of 100, pathogen B has an infectious dose of 200. Which microbe is more virulent? Okay, they are both pathogenic because in this case they have an infectious dose. So they can cause disease, but it takes only 100 cells. Oh wait, this says pathogen, okay. 100 cells, maybe, pretend it's a bacteria, that get into the host to cause an infection. But pathogen B, it requires more. It takes 200 cells to make somebody, to have an infection. So you would say that pathogen A is more virulent because it takes less of that organism to cause an infection. Okay, so the lower the ID50 or the lower LD50, essentially the more scarier or potent or virulent the pathogen is, okay? So again, pathogenicity, yes or no. You're a pathogen or you're not. Virulence is kind of, well, you're a pathogen, but just what does it take to make somebody potentially sick or die, okay? All right, that is going to be the end of this video. Let me know if you have any questions.